Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to shed light on existing policies, projects, and programs within the health sector. In this video, we'll be discussing the Ghana Health Service Code of Conduct and Disciplinary Procedures. Ghana Health Service was established to implement approved national policies for health delivery in the country, increase access to improved health services, and manage prudently resources available for the provision of health services. The vision as a service is to ensure that all communities have access to timely, quality, and comprehensive healthcare. Our core values include professionalism, teamwork, integrity, discipline, excellence, and people-centered service. Good leadership and corporate governance, as well as disciplined and dedicated staff, are required to achieve the mandate, vision, and objectives of the service. The following guiding principles and core values form the basis of the Code of Conduct. 1. Delivering quality health service in a humane and equitable manner within the resources of the country. 2. Upholding the dignity and interest of patients or clients at all times. 3. Upholding the dignity and welfare of all staff and service providers. 4. Adhering to the provisions of the Patient's Charter. 5. Exhibiting high levels of professionalism and excellence. 6. Promoting the corporate image of the service. 7. High sense of efficiency, integrity, transparency, confidentiality, and dedication to the service. 8. Ensuring high degree of justice, fairness, and accountability within the laws of the land. 9. Exhibiting competent and effective leadership at all times. 10. Avoiding discrimination against patients. 11. Promoting continuously quality improvements in health services. As part of our constitutional and civil responsibilities, all service employees shall therefore be accountable to the Republic of Ghana, their immediate superiors, and the governing council of the service. They shall conduct themselves at all times officially and privately in a manner not to bring the image of the service into disrepute or to gain the respect of the service, colleagues, and members of the general public. They shall also maintain political neutrality while in the service, act in accordance with any enactment related to the service and the laws of Ghana, and avoid putting themselves in a position where their personal interest conflicts or is likely to conflict with the legitimate performance of their duties. In 2003, the Code of Conduct and Disciplinary Procedures Manual was developed to regulate and conduct all managers and employees at all levels of the service in their normal relations and dealings with patients, clients, co-workers, and the general public, to address the relevant issues relating to the general administrative rules and regulations, professional codes of ethics, staff conduct, and ethical risk of the service. The manual was updated in 2018 to address new challenges and emerging issues in the health sector, as well as to reflect current national and international standards. All employees, especially management, are expected to be fully conversant with the provisions in this document, which apply to all service employees, personnel on contract or secondment to the service, personnel of the service on leave of absence with or without pay, as well as any other person working with the service under approved terms. Discipline refers to orderly behavior of employees in the service and adherence to existing rules and regulation. Any act of omission or commission contrary to the aforementioned definition constitutes indiscipline. Misconduct refers to an act of commission or omission by any employee, including managers of the service, which may result in failure in performance, endanger clients or patients, or cause damages, financial and/or material and property loss to the service, or any act that will bring the service into disrepute or tarnish the corporate image of the service. Types of misconduct: reporting late for duty or closing earlier than the official time without permission. This includes taking more than the allotted 1-hour lunch break or absenting oneself from duty without approved leave or reasonable excuse. Insubordination: this is refusing to obey lawful instruction of or showing disrespect to superior authority, or willfully refusing to carry out any lawful order instructed by superior. The sale or use of alcoholic drinks of any percentage, narcotic drugs of all forms, or smoking during working hours or at the workplace. Using without approval from the prescribed authority, facilities, and other resources of the service for purposes not connected with official duties. engaging in any activity which is likely to result in conflict of interest, failure to submit reports or information or both as prescribed in the course of one's duties, disclosure of confidential information or documents to any person or institution not entitled to such information, making false declarations or representations, or the use and aiding the use of false documents to discredit the service or cause disaffection from the public, failure to report or take disciplinary action against employees found to have misconducted themselves, professional malpractice, incompetence, negligence, or misconduct, contravening provisions in the Ghana Health Service Code of Ethics and Patient Charter or of the various health regulatory bodies, Commission of Human Rights and Administrative Justice, Code of Conduct for Public Officers of Ghana, and guidelines on conflicts of interest to assist public officials identify, manage, and resolve conflicts of interest. Disciplinary Authority. The President of the Republic of Ghana is the appointing authority and the ultimate disciplinary authority of the Ghana Health Service. However, this responsibility is delegated to the Ghana Health Service Council and other bodies authorized to deal with disciplinary matters within the service. At the national level is the Ghana Health Service Council, the Director General, and Divisional Directors. At the regional level is the Regional Director of Health Services. At the district level is the District Director of Health Services. At the institutional level is the facility head. Disciplinary Proceedings. Disciplinary proceedings under the Ghana Health Service Code of Conduct and Disciplinary Procedures follow these steps. 1. Reporting the incidents within 3 working days. 2. Preliminary investigations which may take the form of interviews, inspection of documents, and a letter of inquiry. Where the results of the preliminary investigation points to a conclusively minor offense or misconduct, the officer in charge shall apply the appropriate sanction within 3 working days. On the other hand, if the results point to a major offense, the in charge shall proceed with formal disciplinary proceedings, issue a query, interdiction, or set up a committee of inquiry. There are 2 types of disciplinary proceedings under the Ghana Health Service Code of Conduct and Disciplinary Procedures. Minor offences are dealt with in summary proceedings, whilst major offences are dealt with in formal proceedings. The following reflects the process of both types. Kindly take note, cases involving national security or violation of the country's law must be reported to the appropriate authorities. When a criminal offense against the Republic of Ghana's law is committed, the matter must be reported to the police. General provisions. Where criminal proceedings are concluded by a court of competent jurisdiction, appropriate disciplinary action shall then be taken by the service upon receipt of relevant court proceedings therein. The complainant or the service, when necessary, should be required to apologize in writing to the employee against whom the false accusation has been made. Additionally, the complainant should be reprimanded in writing. No employee shall be transferred or posted, promoted, or given training or fellowship within the service when disciplinary proceedings are pending against him or her. An employee of the service who has been acquitted of a criminal charge by a court of competent jurisdiction shall not be punished by the service for the same offense. In addition to the forms of misconduct stated earlier, minor offenses include sexual harassment, loafing, non-compliance with official dress code, taking part in illegal demonstration or industrial actions, among others. While major offenses include theft, embezzlement, fraud, or any other situation of negligence leading to financial loss to the service. Sexual or physical assault, falsification of official or client's record, willful destruction of official documents or property. Penalties for minor and major offenses may range from warning, suspension without pay, and a reduction or forfeiture of annual leave to deferment of due promotion for 1 to 3 years, dismissal or subsequent forfeiture of end of service benefits, if any, with exception of social security contributions, among others. A staff member who is aggrieved or dissatisfied with a disciplinary authority's decision may write to request a review of the decision. The written appeal must be filed with the higher authority within 3 months of receiving the disciplinary committee's judgment, after which no further appeals will be considered. Conflict of interest is defined as any situation which has the potential of interfering with the sound managerial, professional and administrative decision of an employee, and which could compromise laid down rules, regulations and procedures of the Ghana Health Service, which may result in unfair advantage to the employee or loss of money or property of the Ghana Health Service. An employee of the service should not put him or herself, family or friends in a position where there are interest conflicts with the functions of his or her office. Any employee of the service who has an interest in a case or transaction which in his or her anticipation may result in a conflict of interest with the service must declare that interest in writing and in confidence to his or her immediate superior officer prior to the proceeding or transaction. In case of proven conflict of interest, the employee shall be removed from his or her normal schedule or post where his or her influence will interfere with the interest of the service. If a conflict of interest results in huge losses to the service and/or state, the matter must be referred to the appropriate security agencies. Please note, this presentation only contains an abridgment of the policy documents or publication. To access the full document or for further reading, kindly visit the service website at www.ghs.gov.gh. Thank you for your time and attention.